another doctor and give the perspective as regards emergency medicine. Dr. Katherine Henderson is President of the Royal College of Emergency Medicine. And, of course, for many people, Doctor, when they think of the NHS, they think of the fantastic teams, paramedics, ambulances and teams in emergency or A&E care. How is that being affected? Good morning to you.
Good morning. Well, it's being affected a lot. It's varied across regions, but the Manchester area, and we saw Liverpool, these are hospitals that are under immense pressure, and they're now at a point where we've got crowded emergency departments and we're finding it really difficult to get patients into beds.
So what needs to be done there?
So, unfortunately, as your last speaker said, every week that goes by, we add to the demand on the NHS. And the only way that we can actually start getting this back working is if we can get community transmission rates right down. I mean, it's the only answer at the moment. We hope the vaccine will, play its part eventually. But unless we can get community transmission rates down, we will see an increasing number of people needing hospital care. And unfortunately, as a consequence, we will ultimately see an increased number of deaths. But along with that goes the actual practical problems of how you run a hospital when you've got a lot of patients with COVID. So we've lost bed capacity because we've had to move beds further apart. We've lost staff because staff are either ill or they're quarantining. We've had outbreaks in hospitals, which is almost inevitable when you've got the levels of transmission that we've got in the community. And again, that reduces our capacity. So the single thing that has to happen is we have to get community transmission down.
And it's the 13th of November. We're entering the winter. Yes, indeed. It's Friday the 13th. We're entering the winter. That's always an acute period for the NHS. How healthy is it going into this winter, Doctor? As regards emergency care, sorry.
No, but, last winter was we were in one of the worst places we ever were. There was no reason to think that this winter was going to be any better minus COVID. With the addition of COVID, it's really, really hard. And it's going to be an incredibly difficult winter unless we see the lockdown actually turning the tide.
Grateful to you. Have yourself a good weekend. Dr. Katherine Henderson is President of the Royal College of Emergency Medicine. Rich, I'll be talking to you. You're still...